If you are one of the millions of Americans looking to enroll in Medicare for the first time or just renew your plan, you might be overwhelmed with all the options available to you. In fact, on average, people have more than 40 different Medicare Advantage plans from which to choose. So how do you choose the plan that's right for you? Humana's Caroline Coates and Dr. Robert Zorowitz are joining us now to explain in this sponsored interview. And Caroline, I want to start with you and the basics. What is Medicare and who is eligible for it?
Thank you. It is complex, so we'll try to help with some information today. Medicare is a federal health insurance program for individuals once they turn 65. You may be eligible before the age of 65 if you have a certain disability or condition, but it is a federal health insurance program that provides health coverage once you turn 65. And there are a lot of options and plans and things to consider. And now's a great time to stop and kind of think about what makes most sense for you, because we are coming up on what we call the annual election period that starts in just a couple days, October 15th, and runs through December 7th, where you can be inundated with all sorts of information on these different plan options and make the right choice for perhaps a Medicare Advantage plan that meets your needs, or if you're on original Medicare, this window can also be used to purchase a prescription drug plan that will provide you coverage for this next year through 24.
All right, Caroline, with so many different options and that window coming up, can you break it down for us? What do people really need to know?
Yes, I will try. So original Medicare, that is the federal managed program, provides healthcare coverage for your hospitals, your doctor visits, emergency care. You pay a deductible and then typically pay about 20% of the cost. If you stay on original Medicare, you also will need to purchase a separate drug plan to cover your drugs, or Part D, or your prescriptions. So that's all under original Medicare. If you choose to learn over the next couple months here, this annual election period, about different Medicare Advantage plans, which are offered by private health insurance companies like Humana, it covers all of that original Medicare hospital and doctor visit, but it also includes your drugs. So it's kind of a package where it includes your doctor visits, your hospital stays, but also your prescriptions, and it caps your out-of-pocket annual expenses. And with the prescription drugs, you then also don't pay those separate monthly payments that you might pay when you have to purchase separately under Medicare. So there's the original Medicare, and then there are all the private Medicare health insurance options that are available. Then in addition to some of the clinical care, there are other benefits that may be offered depending on where you live. And so just all the more reason to take the time to do some research and figure out the best plan that meets your needs.
All right, Dr. Zorowitz, let's bring you into this conversation. There are so many competing plans out there. What should people keep in mind when choosing their plan?
Yeah, I think, a good healthcare consumer needs to consider several things when looking at Medicare Advantage plans. One, is my doctor and the hospitals that I might use covered under this plan? We call that participating or in-network, because you want to make sure that if you do enroll in a plan, that your doctor and the hospitals in your area are covered. Second, really important to make a list of medications and prescriptions that you are using and compare it to coverage in the plan. Because as Caroline mentioned, Medicare Advantage plans typically cover prescription drugs, but you want to make sure that it covers the drugs that you are using. Third, it might be helpful to speak with your physicians about your current health needs and your future health risks that may require additional treatment, so the plan that you select is suitable for those conditions. So for instance, if you have pre-diabetes, consider the potential treatment of diabetes management down the road. And finally, quality is very important. It's really important to check the Center for Medicare and Medicaid Services webpage, which lists Medicare Advantage plans and rates their quality on a scale of 1 to 5. 5 being the highest quality, 1 being the lowest quality. And putting it all together, coverage of your doctors and hospitals, prescription drugs, future health risks, and the quality, it's much more likely that you'll be able to limit all these different drug plans to the 1 or 2 that best suits your needs.
Doctor, it's so nice to get a physician's perspective this morning. Thank you. Caroline, where can our viewers go for more?
Yeah, Yes, you can go to medicare.gov, G-O-V, for a site on Original Medicare that will link you to other plan options, or you can go to humana.com for specific information on Humana plans, and there's information there to connect with someone and actually walk you through some of these options to hopefully make it easier for you.
That site's right there on your screen, everybody. Thanks, you two, and our thanks again to Humana for sponsoring this interview. Take care.
Thank you.
Thank you.